Call it Pop Bubba Sparks.
Booty, 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 rockin' everywhere. Booty, booty.
Hey, I don't know.
Alright, so YouTube, this morning I'm actually going to talk to you guys as far as for a couple of healthcare jobs that do not require a degree. Lately, I have been trying to look up some jobs that's working from home that I will discuss to you guys about a little bit later. But however, there are some jobs that, you know, don't require a degree, and you have a lot of people that's trying to enter into the healthcare field. So hopefully this could be able to help you out. For starters, you do have cardiovascular technologist. You have on here dental assistant. You have on here ultrasound techs. You have also EMTs and paramedics. You also have massage therapists, of course, medical assistants. And you also have on here, you know, CNA, of course, certified nursing and whatnot. So let's get right into it. Most people, if you're thinking about joining the medical field throughout the COVID-19 times, I definitely feel like it's a start, but at the same time, you got to realize what you're getting yourself into. It's not the same. I feel like wearing the mask all day is kind of like a, it's kind of like aberrance for most people. You know, some people have breathing problems and stuff like that, so you got to get used to that. But however, the cleaning and everything like that, we do that on an everyday base. So let's get right into the video. Cardiovascular technologist, it kind of reminds me of an ultrasound tech a little bit. Basically, they work with ultrasound imagings and testing and surgical procedures, including the heart and vascular system. Technologist usually works in hospitals or clinics where they work closely with surgeons and doctors. They may assist as far as for treatments for the patient with the heart, and as well as the average cardiovascular technologist's salary usually falls between $57,000 in a year. Now, with most healthcare jobs, you do not want to keep looking as far as for how much you make a year, because some jobs you can make a lot of money a year, but at the same time, it may not be something that you're willing to do. It may not match what you're willing to do. So do check into that. Next is dental assisting. Now, I do have a couple of friends who did dental assisting. If you guys watch any of my previous videos, I actually started off with dental assisting with my medical field journey or whatnot, but I didn't too much like the set of girls that I was with, so I kind of switched to medical assistant. Another one as well too. All you'll need is a certification. Dental assisting usually lasts about like a year and a couple of months to complete. That was actually one of the longest, well, besides nursing, but if you're talking like short term to get into the medical field, that was one of the longest ones out of medical assistant. Medical billing and coding, I think that was a little bit longer than that one as well too. But dental assistant is something to start off with. Basically, you help support the dentist by cleaning their teeth, taking x-rays, checking for signs of oral disease. Also, you play a role as far as for like how a medical assistant will as far as for a doctor. So basically, you do any duties that they tell you to do, probably checking the patient, clean up the rooms, clean up the examination rooms, set out the supplies for anything, make sure everything is set up. Dental is something good to get into. I'm not gonna lie, most people that I see in the dental field, they have a good look, they're clean, they teeth look nice, it's very nice. So I feel like that's something to kind of get into. Not many people want to start off with dental assistant, so I feel like if you do start off with dental assistant, do plan to finish. The next one is going to be ultrasound techs. Now, like I said, this reminds me of the cardiovascular technologist. Pretty much, you may know an ultrasound tech as a diagnostics medical sonogrammers. These are professionals who prepare for appointments and sonogram equipment. It's something to do. Usually, they make around $72,000 a year. Alright, so y'all, so for the most part, I feel like with ultrasound techs, I feel like it's a good field to get into. One, because everyone do need an ultrasound tech when it comes to dealing with babies. And when I tell y'all, throughout 2020, it's so many people that's been pregnant, you guys, and I feel like it's a beautiful thing. It's definitely a beautiful thing. It's a challenging thing as well too. For the ultrasound techs, usually takes as far as for a certificate to complete. Now, if you're looking to go a little bit more in depth as far as for ultrasound tech, degree may be required, but for the most part, certification is pretty much good. Or if you've been working into the field as far as for that. One thing I can say about ultrasound tech is that I like is that the fact of when I was working OBGYN, we got the experience with ultrasound tech, so I thought that was pretty cool. For the most part, I feel as if like you get that experience where one, you get the one-on-one with the patient because they're so excited to see what's going on with their child, and then two, you get also, you know, get to see firsthand yourself, you know, to see as far as for how is it like, where you're hearing the heartbeat, where you're seeing the physician put the probe on the patient and stuff like that, you know, all those type of things. Now, what our job was to do throughout the ultrasound tech when dealing with OBGYN is pretty much we would help assist with ultrasounding. So whenever they would go into the ultrasound room, we had to have everything set up where we would have to have the probe ready, we had to have the lubricant ready, have the light positioned a certain way how the doctor would want it. So those are the type of things you want to keep in mind when becoming an ultrasound tech, is that you're mainly going to be dealing with imaging and most likely OBGYN patients, which is, I think, is a good field. After passing your professional certification exams, there's an average of $72,000 that an ultrasound tech usually makes. Now, that may be different depending on the state that you live in. So with all these salaries that I'm giving you guys, they're different in the different state that you live in, because I know a lot of people gonna come in and say, well, hey, in California we make, you know what I'm saying? So this is off of what I'm seeing, but it definitely does switch up depending on the state that you stay in. Okay, next is going to be for EMTs and paramedics. So basically EMTs, a lot of my friends have gotten to the field for EMTs. One thing I can say about EMT is that basically they get acknowledged a lot. Like basically with this COVID-19, they always say, oh, we'll give the healthcare workers a percentage and stuff like that, but they have to be EMTs, or they have to be a nurse, or they have to be a doctor. Like they're getting so specific of what you have to be, and I'm just like, we all work in the healthcare field. Why should it be a specific, you know, type of thing? But that's besides the point. Basically EMTs, paramedics, they pretty much make as far as for $59,000 a year. One thing, depending on the type of training that you get. Now, one thing I say about EMT, I feel like that's a step as far as for the medical field, because most people want to see what it's like for the rush and adrenaline that you get as far as for paramedics. They're constantly always on call. If you guys ever be riding down the road or anything, you always hear the ambulance coming from way across the field and stuff like that. So, you know, those type of people, they like to be on call a lot. So at the end of the day, you know, you get paid enough, but to me, it's so much going on. EMT is not something I would be looking forward to. But however, if you're looking to get into that field, it's definitely a good start with the certification, and you could work your way up as far as for getting more deeper into the field, the more schooling that you continue to do. This other one is going to be for medical massage therapists. Now, believe it or not, massage therapists make a lot of money. Some people may not see it, but massage therapists do make money. They seem as if they're so relaxed all the times, but massage therapists, massage therapists pretty much helps to treat injuries and relieve chronic pain. One thing I can say about a massage therapist, they do come in handy when working with pain management. A lot of patients do have to continue to do 6 weeks of therapy whenever they have an injury done, whether it could be from a car accident or anything like that. And therapists are needed. Like when I tell you, they could be needed whether they're at your house or you're at the facility. They're a major part as far as for the healthcare field, and not many people pick massage therapists. So I would definitely seek certain jobs before you be so quick to jump to the gun as far as for, oh, I want to just do medical assistant, or I want to just do CNA. It's other jobs out there, you guys. That's why I really haven't really like so much signed up for nursing just yet, because I'm still trying to see other jobs where it's like, if you think about it, all the females are usually so quick to say, oh, I want to be an RN, I want to be an RN. One, it's like, it's good and beneficial, but at the end of the day, are you physically, mentally ready for RN? You know what I'm saying? It's a lot of people that just want to be so quick to jump to the gun because of how much money the field makes. But if you do your research, see if that's something that actually fits you. Of course, we're going to run into the last two, which is medical assistant and CNA. So with those two, you do not need a degree. Now, however, if you're looking to get a degree, you can get more money. They do have registered medical assistant and whatnot, and a lot of medical assistants do have their AA degree. But however, medical assistants, you guys know the basic. Basically, you take your vitals. It's the same thing for CNA, except with CNA, they're a lot more closer with the patients. They're doing a lot more bedside stuff with the patients as far as for observing them in the bed and stuff like that. With us, with medical assistant, is more of an in and outpatient type thingy. It's more of an outpatient because you don't really have to stay in like that unless you're probably getting a certain procedure done, but everything is in and out. One thing I can say about medical assistant, it's a fast career to kind of get into the medical field. It could really open up your eyes and let you know as far as for, is it really for you? Do you really like the medical field, or is this just something to just start off with? Me personally, I like medical assistant, but at the same time, it's just, it has its ups and downs. But for the most part, with my age going on, because I'm just 23 right now, you guys, I'm gonna continue on with medical assistant until I really see what I want to do. I looked into so many other medical jobs, you guys, where it's like, you know, if you're looking to further your career in the medical field, but it's not so more just nursing. That's why I just want you guys to kind of expand your horizon when it comes to the medical field, because there's so much money out there, and there's so much opportunity. So don't just be so quick to jump to the gun. But at the end of the day, these are healthcare jobs that are pretty popular, that most people don't really, you know, get a chance to take a look at, where you're probably thinking like, man, I want to get into the medical field, but I don't have enough money for nursing school, or I want to get in the medical field, but I don't have enough money to become a doctor. Start off small. Start off with something that most people don't really start off with. And if you guys really want to see other types of name jobs for the healthcare field, when you go on the website, say for instance, if you go to apply on Baptist, or if you go to apply on Mayo Clinic, or if you go to apply on stvincents.com or something like that, they have a whole list of other jobs. They have like screen monitoring, they have patient sitter, they have so many stuff, you guys. Like, it's just all about you just trying to expand your horizon while looking for a healthcare job in the healthcare field. So hopefully this be able to help you guys out. Comment below and let me know what you think. And if you do work at any of these type of jobs, let me know, do you like it so far? If you're a cardiovascular technologist, do you like it? If you're an ultrasound tech, do you like it, or do you not? What do you think? So hopefully everybody stay safe. Have a good one, y'all. Peace.